I'm Abby.
And I'm Danny.
The topic of our presentation is Neuroscience and Occupational Therapy, Vital Connections, 1989 Eleanor Clark Slagle lecture.
Okay, so we'll start by telling you a little bit about the author of the article that we're presenting on. This is Shireen D. Farber. She's a PhD, OTR, and FAOTA, which, if you're not familiar, that's a fellow American Occupational Therapy Associate. She's an honorary designation in AOTA. She is the Assistant Director of Occupational Therapy for Administration. She's a consultant for neurorehabilitation services, and she is the author of a book called Neurorehabilitation, a Multisensory Approach, which discusses the neurorehabilitation while focusing on neonatology, stress management, adaptive equipment, and more.
So some of the key concepts that we're going to be going through in our presentation is how neuroscience enhances our ability to understand aspects of human behavior. We're also going to talk about how neurobiological information can be used to design research to evaluate our existing treatment philosophy and methodology, and how we can use it to develop new theories and technology. The three main concepts that we're going to be reviewing is neuroimmunomodulation, organic bases of psychopathology, and traumatic brain injury. So for neuroimmunomodulation, it's the relationship that exists among several body systems, including the central nervous system, the immune system, and the endocrine system. And then for organic bases of psychopathology, we're going to talk about how it applies to schizophrenia. And for traumatic brain injury, we're going to talk about factors that influence the reorganization of the central nervous system after the injury.
Okay, so this is a lot to unpack, so kind of stick with us for a bit. We'll just kind of explain it, and then we'll explain how it applies to us more specifically, so you can really kind of get more engaged with it. So neuroimmunomodulation describes interdisciplinary practice that studies the relationships between the human body and basic sciences. And we really feel like this is interesting because it really determines human behavior, and that's what kind of sparked our interest. So to add to that, various immune elements can cross the blood-brain barrier and interact with the CNS. In turn, several CNS sites send regulatory messengers to interact with multiple body regions. Additionally, neuroendocrine products, so that's going to be like your hormones, your peptides, and releasing factors, really influence the function of the body's endocrine, immune, and nervous system structures.
Okay, so how is neuromodulation relevant to occupational therapy? So understanding how the body works and understanding all the body systems can help occupational therapists understand how and why people become ill. Then therapists can use this information to counsel patients to modify maladaptive lifestyles that contribute to either immunosuppression or overreactive immune reactions. So just kind of to rephrase that, occupational therapists can use the information they know about the body systems and how the body works to better create interventions that target the client and the underlying neurological issues.
Okay, so now we're going to talk about how neuroimmunomodulation relates to chronic stress. So corticosteroids and adrenaline will be like our main focus of this. In small amounts, corticosteroids and adrenaline can be really useful in fighting stressful situations, but we know that in chronic situations, such as depression or long-term stress, corticosteroids and adrenaline, or both, are known to suppress T-cell competency. So what does that mean? Our T cells are white blood cells that play a major role in the immune system. We have helper T cells, which facilitate B cell maturation, which are responsible for producing antibodies. And then we have suppressor T cells, which basically just kill off any invading foreign substances. So if you have like bacteria or something or a virus, that's what's going to have that response. And why that's important, we kind of can apply it towards us as students. Like, we are constantly in situations of chronic stress from school or in fieldwork, and I'm sure many of you have experienced times where you feel like maybe during finals or even during fieldwork where you're suddenly getting sick all the time. And this really explains that interaction because you're constantly having corticosteroids and adrenaline produced at a rate that is harmful to you and really suppresses your body's ability to fight off anything and keep you healthy.
Okay, just to kind of continue off of what Danny was saying, the relationship that chronic stress has to neuroimmunomodulation. So, chronic stress is also related to the fluctuations in the pineal gland, which takes part in our circadian fluctuations. So, chronic stress reduces the function of the pineal gland. What is the function of the pineal gland? It secretes melatonin, which improves our overall immune competency. So, therefore, when chronic stress negatively impacts secretions of melatonin, it reduces our immune system or immune response. So, melatonin is the hormone that controls your sleeping pattern. So you might find that when you get less sleep, right, or if your sleeping pattern is being affected, you're sleeping more, you're sleeping less, you'll find that it really impacts your immune system. So they have a really strong correlation together.
Okay, so now we're going to talk about neuroimmunomodulation and exercise. So, exercising in moderation is a really important thing to keep in mind. When we look specifically at the hormones involved with exercise, we know that opiate hormone modulates pain perception. And why is this important? So, I'll break it down. In moderate exercise, it releases endorphins and can produce a sense of well-being, and it will kind of produce the appropriate pain perception response, as opposed to extreme exercise, which you could think of as maybe like running a marathon or just really excessively working out to the point where you're not letting your body rest and you're not really taking care of yourself and overexerting yourself. This can actually compromise the immune system, and it will really negatively impact your pain perception response by overproducing the opiate hormones. And therefore, it's really important to exercise in moderation just to really focus on keeping yourself healthy and making sure that your immune response is maintained.
Okay, now we're going to talk about the relationship with neuroimmodulation and aging. So, as we know, as we age, we experience a decrease in our immune system competency, and the decrease in mobility as we age also affects our immune system competency. So, this relates to occupational therapy because we can help teach our clients relaxation training because that has proven over time to improve T cell competency and therefore create a better immune response. Occupational therapists can also plan appropriate types of activities and, the amount of exercise. So making sure that it's not too much for the client and not too little, making sure that the amount and the type of exercise is just right. In addition, occupational therapists can assist with environmental modifications around the home of the elderly or just in general as they, ambulate in the community or in the home to better enhance their occupational behavior.
Okay, so now we're going to talk about neuroimmunomodulation and its relationship to depression. So, people with depression have altered immune responses. We see that they have compromised T cell responses, like we described before, which really means that their fighting system in an immune response is affected. So, what we can do, we know that emotional well being can enhance immune function. So, what OTs can specifically do when working with clients with depression, they can emphasize programs with activities for both the mind and the body. So, that could be something like yoga, where you're emphasizing stretching and moving and strengthening, but you're also focusing on the mind and exercising the mind and deep breathing, things like that. And then we can encourage patients to establish positive attitudes of empowerment and reduce helplessness and hopelessness to increase immune function. So just really improve their overall mood and well-being, give them the resources they need so that they can have a better immune response and then function better in their activities of daily living.
Okay. Next up is the relationship between neuroimmunomodulation and AIDS. So listed here are some attitudes of long surviving patients who were diagnosed with AIDS. So first off, they had a realistic attitude. They were able to accept their disease, but also believe in life. They had a fighting spirit. They were able to modify their lifestyle and leave behind maladaptive situations. They were also shown to be assertive. They shown to attend to their personal needs. They were able to talk freely about their illness. They also assumed responsibility for their own health and considered themselves a part of the treatment team. And lastly, they helped others who have been diagnosed with AIDS.
Okay, so now we're going to talk about the next topic of our article. The topic is organic bases of psychopathology and how they relate to schizophrenia. So research suggests that in some cases of schizophrenia, there may be an underlying autoimmune abnormality. So really, the autoimmune response is going to impact the symptoms you see of schizophrenia and kind of the physical components as well. So this suggests that components of the immune system attack the central nervous system as though it were a foreign enemy in the body, basically. We also see that schizophrenic patients have been found to have enlarged ventricles, fissures, sulci, and decreased amounts of cerebral cortex in the brain. The disturbances of thought and affect seen in schizophrenia are due to changes in brain morphology, metabolism, or neurochemistry. And you can see in the picture that we have included the differences between a brain of a patient with schizophrenia as compared to a healthy control. You can see there's a lot of differences there.
Just to continue off of what Danny was saying, common abnormalities seen in the brains of patients diagnosed with schizophrenia is that they have an abnormal use and regulation of glucose, which is your sugar, particularly in the frontal lobes and the basal ganglia. They've also shown to have decreased neuronal activity and decreased cerebral blood flow. In addition, the dopamine and noradrenaline abnormalities are present in the CNS. They also either have sensory overload or sensory saturation. And lastly, they have autogenic deficits in both the limbic and thalamic nuclei, interfering with the frontal lobe development. So this is correlated to schizophrenic patients being less able to create behavior on the basis of prior experience.
Okay, and we'll continue on with schizophrenia. So some things to look for. We know that negative signs are the loss of function. We see in patients with schizophrenia that there's a decrease in affect overall. There's generally a decrease in attention, a decrease in ability to experience pleasure, and there's emotional attachment issues and a decrease in the ability to initiate. We also see that they will have irregular post-rotary nystagmus and oculomotor responses, as well as postural mechanisms. So it really, again, kind of shows you that like physical response that's really impacting them in the brain and in those natural reflexes. So then we see positive signs, which represent a distortion of function. So that will include things like hallucinations, perceptions of non-existent sensations, sensory flooding or saturation, faulty neurointegration, and increased delta waves on electroencephalograms.
Okay, so how does schizophrenia relate to occupational therapy? So there were two occupational therapists, Stein and Nikolic, that found that relaxation techniques among patients with schizophrenia showed significant improvements on a standardized state trait anxiety inventory. In addition, occupational therapists found that when you address all aspects of an individual's being, including mental and physical, that you can help increase their overall functional performance. OTs also found that a neurorehabilitative approach may serve as a useful adjunct to traditional OT interventions designed to promote adaptive behavioral responses. Occupational therapists use controlled environment demands and stimulation when working with clients with schizophrenia to create more adaptive behavior.
Okay, so now we'll talk about some more things that occupational therapists can do for patients with schizophrenia. there's a big focus on sensory integration approaches and mindfulness approaches. So with sensory integration approaches, it's going to look a little different than what we kind of think of generally with SI. It's not going to be the same like sensory diet that you really see in, say, children with autism when we're using this approach. It's going to limit the sensory stimuli to be more specific. It's going to use less of a multisensory input approach and more of a single sensory modality. So that's going to be, instead of having a bunch of different sensory experiences like touch and smell and taste at the same time, you're going to focus on one at a time so that you limit the input that the patient is receiving, and then they are able to like more focus themselves, orient themselves, and feel less overwhelmed. And then in addition to that, OTs can advocate for more OT in mental health specifically so that we can reduce the group sizes for treatment when we're dealing with patients with schizophrenia, because by reducing the size of the groups that we're working with, we can have more of a one-on-one approach. And by doing that, we're limiting the environmental stimuli in the group therapy setting, so giving them less of an overwhelming feeling. They can really just focus on what they're doing, the task at hand, and really reduce anything outside that would distract them. And then in addition to that, we can use relaxation training to reduce anxiety and increase T cell production. So again, just kind of working on that deep breathing, work on mindfulness, things like that to really boost their immune system and boost that T cell production, so you'll see less of the positive and negative signs of schizophrenia.
Okay, so our last key concept that we'll be addressing in our presentation is traumatic brain injury. So plasticity is the brain's ability to remodel connections in response to development, environmental changes, learning, stimulation, nutrition, and injury. So after someone suffers from a traumatic brain injury, there are a sequence of events that happens in the central nervous system. The first thing that happens is that the CNS goes into shock and synaptic activity is decreased. Then there's cerebral edema. After that, there's increase of intracranial pressure, compressing the blood vessels. And then there's edema that causes increase of cell death. This happens because due to the compression of the blood vessels, there's a lack of blood and oxygen getting to the cells, which causes an increase in cell death. So how does this relate to occupational therapy? So when working with clients who have been who had a traumatic brain injury, we can focus on environmental stimulation and multisensory input to produce habituation. So as we mentioned before, the brain has the ability to remodel connections in response to stimulation. So occupational therapists can use different types of environmental stimulations or sensory stimulations, such as lotion, as seen in the picture below, smelling familiar smells, performing familiar activities, seeing familiar things. These will all help the brain create new connections in the brain. So this is a great approach when working with clients with TBI.
Okay, so we know that was a lot of information for you guys, but we hope you are able to see how it connects to us as OTs, as OT students, and how we can use that when we do go into our career. So as occupational therapists and healthcare professionals, it's our job to utilize neuroscience, new methodologies, discoveries, and evidence-based research to treat our clients. And this information is really helpful. It is a little bit outdated because it is from 1989. So we know there's a lot more research we can look into now. So that's kind of our responsibility now, is like, what more can we get from this foundation that we've been given from this article? And then just knowing that the interactions between the various systems of the body influence the overall health of our clients by affecting the immune system and therefore affecting human behavior. And it's crucial for OTs to understand the relationship between the neurosciences and behavior in order to best serve our clients in the future, but also to really focus on how we can best serve ourselves as OTs, make sure we're taking care of ourselves and making sure we are reducing chronic stress so that we can have better immune responses and better functioning overall, and then be the best support that our clients need. So it's not only going to affect our clients, but ourselves as well overall.
Okay, so the reason we chose this topic is because we felt a personal connection and interest to this topic. So for me personally, when I was completing my level 2 fieldwork, I had a client who had a traumatic brain injury. And I feel like learning more about his diagnosis and learning more about how traumatic brain injury affects the central nervous system and affects, the cells in the brain. And then again, learning about plasticity and learning about the brain's ability to reform depending on, stimulation. I feel like, further understanding his condition, we were able to create an intervention based on his underlying neurological condition, and being able to target our intervention on those underlying neurological conditions, we were able to really treat him better. And I feel like overall the interventions were more effective, and we saw a lot of um, progress. And kind of just what we were going to back before, like the whole point of neuroscience and understanding it is to help occupational therapists better treat their patients. And from a personal experience, I found that that really did help in both planning the intervention and also seeing progress in my client's therapy process.
And then to continue on from what Abby said, for me, I had a really big personal connection. I've worked in ABA, so really just have a big interest in understanding behavior in itself. And then I was in a pediatric sensory SI clinic for field work too. And that's really where my passion is. So I really wanted to get a good foundation of neurosciences because I've seen firsthand how it really impacts my clients. I worked with kids who were on the spectrum that they had compromised immune systems, and you could really just see the direct correlation between how they were feeling, like if they were ill, and how that affected their behaviors. So you would see a spike in their behaviors. They'd have more tantrums, they'd have more elopement, things like that. So we really wanted to kind of get into that more and understand it better. And then just really understanding how SI approaches can be understood more as well. Just really looking at how it affects the brain and what we can learn from that information overall.
Okay, so our questions for the discussion forum this week is: in what ways has your immune system affected your ability to participate in occupations, for example, chronic stress, depression, etc.? And what self-care strategies have you used to improve your immune system, therefore improving your ability to engage in meaningful occupations?
All right, thank you guys so much. We hope you enjoyed our presentation, and we really hope that after learning all this information, you're able to apply it towards your studies, towards your overall well-being, and really use this information when you guys are treating in the future with your clients, and just kind of understand how the neurosciences are just a really important thing for us to better understand in the future. Thank you.
Thank you guys. If you have any further questions regarding anything that we talked about today, or you need further clarification, feel free to mention that in your discussion forum this week, and we'll try to get back to you, with the best of our knowledge. All right. Thank you guys.
Bye.